Hello everyone, I'm Hen Yassin, lecturer of medical biochemistry and molecular biology, Faculty of Medicine, Alexandria University, and I'm talking about the critical appraisal as a part of evidence-based medicine course for the ML Web on MOODLE group number 1, and this is for track 1, supervised by Professor Dr. Yasser Al-Wazir, and the group members, year 2 fellows, Dr. Naveen Hindawi and me, and year 1 fellows, Dr. Aisha Saifuddin and Dr. Hani Al-Kahwabi. By the end of this session, you will be able to define critical appraisal, mention the causes why critical appraisal is really needed, and describe the main steps for critical appraisal. First, when we talk about critical appraisal is the process of carefully and systematically examining research to judge its trustworthiness and its value and relevance in particular context. Actually, critical appraisal is essential for the informed decision, as it allows clinicians to use research evidence reliably and efficiently. This is a process very challenging. Critical appraisal is needed because literature researches using the database like Medline or others often result in an overwhelming volume of results, which can vary in quality. So critical appraisal helps researchers to reduce this burden and allow them to focus on the articles that are relevant to their research question and that can reliably support or even refuse its claim with the high quality evidence. Also, it helps researchers to identify the high level research relevant to their practice. So, to summarize, critical appraisal is intended mainly to enhance healthcare professional skills to determine whether this research evidence is true, let's say free of bias, and relevant to their patients or not. The critical appraisal allows us to assess the validity and to assess the usefulness and the clinical applicability of the studies and recognize any potential for bias. How can I critically appraise evidence? First, we have to identify the clinical problem, the problem we are concerned with, and then formulate a clinical question by one of the accepted formats, and then search for the available literature, critically appraising the literature, evaluating the research to inform clinical practice. There are lots of checklists which are available for critical appraisal. This is an example of a checklist. They have some of the items like would the sample representative of the target population or not, the study participants are recruited in the appropriate way, where the sample size is adequate, the sample subjects and setting described in details, and other questions. That's why we want to focus on some important questions in the critical appraisal process. Actually, it's not easy as such, but just to simplify, we will focus on some important questions. First, what type of the research question is being asked? And this will depend on the type of the study. Either you are dealing with qualitative or quantitative research. For example, the spider format is used for qualitative research, and the BICO format is used for formulating questions for clinical research. Second, would the study design appropriate for the research question, and about the levels of evidence which were described in the lecture before, and according to the type of question, for example, prevalence study, so they use a cross-sectional study for the causation, for the risk, for the prognosis, we can use case control study, cohort study, or RCT, for the treatment efficacy, the RCT randomized control studies, and so on, the appropriate study design for the specific type of question. And here we come to the levels of evidence, and it's well known that there is levels of evidence, the levels of evidence pyramid, the EBM, the evidence-based medicine, and here come at the top the meta-analytical studies, and then the systematic reviews, the RCTs, the double-blind RCTs randomized control trials, which helps to answer the treatment question and diagnosis question, the cohort study, the prospective cohort, for example, to study, to answer the prognosis question, the case control study, and there are lots of items when we explain the case control and cohort study. For example, if it's a rare disease, we use case control study. If we are dealing with a rare exposure, so we use a cohort study, and so on. Then in the lower base of the pyramid, the case series and case reports, and the animal studies and laboratory studies. As you know, also when we are dealing with the harm, we cannot use prospective cohort, for example, because it's non-ethical. So we can use other studies like the case control studies or even the retrospective cohort. The third question, did the methodology address important potential sources of bias? What are bias? Bias, they are any deviation from the truth, causing the distorted results and consequently wrong conclusion. Bias can occur at any phase of the research, including the data collection, the data analysis, the interpretation, or even publication. And also research bias can occur in in qualitative and quantitative research. However, one of the most common types of bias are selection bias. And in selection bias, if the bias introduced by the selection of individuals, groups, or data for analysis in such a way in which proper randomization is not achieved. So the sample is not representative of the population, and this is one of the common types of bias. There are other types of bias, such as the survivor bias, such as the recall bias, or other types of bias. So we have to check if the methodology address important potential sources of bias. This is very important in critical appraisal. The fourth question, does the study test a stated hypothesis? The stated hypothesis is the hypothesis which the researcher had put at the beginning of his study, which most probably say that there is a null hypothesis, which states there is no association between the exposure and the disease, for example, and the alternative hypothesis that there is significant association between the exposure and disease, which is H1 or HA. Number 5, were the statistical analysis performed correctly? This is very important. Starting from the sample size calculation, the proper sample size calculation, going to the type of statistics, descriptive, inferential, or using a parametric or non-parametric test, if based on the assumption if the data are following the normal distribution or not, and so on. All that are lots of factors which are involved in statistical analysis and the choice of the statistical analytical tests. Number 6, you have to ask the question, are there any conflicts of interest? Here in the research, the conflicts of interest refers to the situations in which the financial or other personal considerations may compromise or even have the appearance of compromising an investigator professional judgment in conducting or reporting research. There are lots of regulations for preventing and ensuring that the submission of this research has no conflicts of interest, has no any factor which may compromise the results. At the end, an important question, especially in the clinical research, will those results help me to manage my patient? And this will depend on the clinician, on the expert experience and the expert knowledge. So he has to search and be sure that those results will help to manage his patient. At the end, of those most important, there are lots of other questions in the critical appraisal, but these are the most important points. So you can critically appraise the article, aiming to reach the best evidence for your research question. About the assignment for week 2, evidence-based medicine, track 1. In week 2, we are aiming that in the week one, in the week one assignment, you already formulated a properly constructed research question. So in week two, please use this research question to search for the best evidence. And then choose one of the articles which you are interested in, which you like, and critically appraise this article using one of the checklists which you have, it's okay, or in the pre-reading material on the Moodle, we uploaded for week two some of the checklists which you can use for the critical appraisal process. So it's very easy. You will use the research question you formulated to search for the best evidence, and then choose one of the articles which you found during your literature search and review, and critically appraise this article. Thank you so much. Good luck.